Alright, so in the last video we spoke about insulin and some of its effects, right? So one of them, or at least two of them, is hypoglycemia and hyperglycemia. So hypoglycemia is when your glucose is like very, very low, lower than it should be, right? So remember, glucose is supposed to be like above 4.5 and about to like a 7. That's like normal range, right? When it's above that, we say that you're suffering from hyperglycemia, your glucose is too high. And when it's below that, then you have hypoglycemia. Now we're going to share some of the symptoms of them. Remember, they might differ for certain people depending on what you're doing, but these are kind of like the general symptoms that you would suffer from if your glucose is very low. Firstly, your hands might shake, especially when you're doing something. Your hands might shake. You might find it easy to get confused. You get easily confused. And then you start sweating, even though you're not doing like a strenuous activity. So now you just start sweating out of you start sweating out of the blue. You might get dizzy. You might get dizzy. You might get anxious as well. You might get like anxious or easily irritable. When I'm sleeping and I suffer from a hypo, I actually get nightmares. I get a nightmare and I wake up. I'm like, oh, I need to check my glucose. I check my glucose, and then I can take a fast-acting carbohydrate. Right? I take like a fruit. Sometimes I eat my mayonnaise. Sometimes I stand up and go take a fruit. Sometimes I have like sugar with 3 teaspoons. Okay, and then after 15 minutes, I check if my glucose is okay. That is kind of like what happens when I suffer from low blood glucose, right? And then the next one is hyperglycemia, where your glucose is very high. Oh, actually, before we get to hyperglycemia, the signs that I gave you for a hypo, those are like the warning signs before, right? But I think as time goes on, when it gets extremely low, then you might lose consciousness. You might start suffering from slurred speech. Sometimes I find that my fingers start to like tingle when it gets really low, and my heart starts beating like rapidly. But those are like for like when it gets really low. Some people do experience the symptoms when they're like from 4.5 to like a 3, and it just gets extreme with others. Sometimes people don't feel it, especially when it's like 4.5 or like a 4. Some people feel it when it gets to like 2.5. But basically, just know that when it's below 4.5, you need to keep like an eye on it, right? Because you don't want to suffer those early, you don't want to ignore those early warning signs and those dire ones where you kind of now lose consciousness and have to be hospitalized and stuff like that, right? And then number 2, we have hyperglycemia, where your glucose is really high. Now it can go up as like 12, like 5 hours after you ate, your glucose shouldn't be like at 12. That's a very high number, and it shouldn't be like that, right? Now, the warning signs are you might suffer from thirst, and because you're so thirsty, you want to drink a lot of water. And when you start drinking a lot of water, you're gonna have like frequent toilet visits, right? You're gonna like feel the need to pee very often. You might also get like a bit nauseous. You might get like blurred vision. Like sometimes, like when your glucose is high, you get like blurred vision. Sometimes you get very nauseous and you feel like you need to vomit. And then what? I forget. You might get a dry mouth, or you might be tired, even though you know you haven't done something that really makes you tired. So those are like the warning signs, like thirst, frequent urination, fatigue, a dry mouth, and then like when it's been high for quite a long time, you might start suffering the symptoms of DKA, right? So that's ketoacidosis. Yeah, diabetic ketoacidosis. So you might start suffering symptoms of like your breath starts having like a fruity smell. You start vomiting, and when you start vomiting a lot, then you might need to check your ketones. But I know that a lot of people in South Africa would not have ketone strips, so you might have to kind of like visit a doctor when you start, like when your glucose is really high, you have like a fruity smell in your breath, you start vomiting, there's like stomach pain, you have like stomach pain, and you're starting to get a bit drowsy, then you know something is wrong, because then that one is dangerous, right? Because DKA is very dangerous. Diabetic ketoacidosis is basically when you go into a coma because of diabetes. Just think of DKA as a diabetic coma, because your glucose is so high that your blood is now toxic. And yeah, so yeah, those are the symptoms. But remember, all of this may differ from person to person. So what you experience is different from what the next person might experience. In my experience, I've experienced some of these, not always all of them at the same time, but generally when I start noticing all of the symptoms, I would like check my glucose. But you guys know that I use a sensor, so I would just check my sensor and see what's happening. Yeah, ne? Hola, and stay safe.